AI is taking over a lot of things. Now, how do you think AI and healthcare
Hmm.
is going to be synonymous in this? And then what do you think that how AI is helping in the healthcare sector for all doctors and especially surgeons? And
As a doctor, I'm extremely happy that AI has happened,
perfect.
because previously people used to go to a search engine and Google whatever the symptoms used to be there,
Hmm.
and then get worried about it.
Yes.
But now Google AI or whatever AI,
Yeah.
it can be Chat GPT, it can
It
be
could be
anything,
Gemini,
Gemini,
could be
Grok or Claude and
yeah,
anything.
Claude, anything.
They are also guiding the
Perplexity.
patient, perplexity. They're also guiding the patient when they're getting worried. For example, previously, if you say causes of stomach pain,
Hmm.
right from cancer, everything used to be. But if you ask something like, if you say AI, and AI will think like how humans actually do.
Absolutely.
So it will say it could be an ulcer, it could be gastritis. So this is actually giving help to doctors, and patients are coming to them with some problem,
Hmm.
and they say, doctor, I googled it and this came. That was some worrisome for us.
Correct, correct.
But now they're saying, doctor, I have this problem and these are the symptoms, and I did an AI of this and this has come out. Do you think it is this? There are some patients like this. So why it makes life easy is now the patient is a little more knowledgeable. He knows what is happening, and as a doctor it is easier for us to counsel that patient,
Correct, correct.
and it
They don't
reduces.
just come back with something like, oh, cancer.
No, it
Or
won't. So
something.
they're becoming more and more knowledgeable.
Yeah.
Second thing, the way AI is helping us is, very importantly, whatever there are certain scenarios where uh, there can be confusions.
Mm-hmm.
What to do next? There are chances where we might have to meet with a colleague and
Correct.
try to understand what could be the best course of
So
action in
that's
this
like
type of
complicated cases.
complicated cases. So what a colleague used to help us with, now definitely AI is also like an online colleague. That's why I say.
Correct.
That's why I say.
Wow, online colleague. Yes, it is actually. We
Yeah.
use AI in our space and advertising and stuff like that. And I'm sure. So, what do you think that does AI? You get help of AI for your healthcare, but how much of research AI has done to give a very authentic answer to your problem because it's human health.
Hmm.
So, does that really help? Is what I'm asking you.
Obviously, whatever it gives out will be filtered with our
Obviously, you'll
knowledge.
vet it, of
Yeah, will
course.
be filtered with our knowledge. But till today, from whatever I could see of the various AI apps that are there,
Yeah.
most of them, all the time, almost all the time, have not been way
Outer,
outliers.
exactly.
They actually hit the bull around the in the bullseye only, plus or
Mm-hmm.
minus, and it only, as you said, I have to say yes to it, and yes, it looks like that. So definitely, what is AI? It is nothing but people say it's artificial intelligence. No, I'll say it is augmented
Mm.
intelligence.
Mm.
So it is augmenting our intelligence,
Yes, it is.
and it is augmenting our
And it is
treatment.
trained because whenever you are using AI, it
Huh.
is trained with your information that you're giving. The more information you're giving, AI learns it better.
Better, true,
And it
absolutely.
goes on giving you better quality comes
Quality.
out of exactly what conversation you and they are trained completely
I know.
with your conversations, what you want.
I know. So what I'll say is, for example, if in a treatment protocol
Hmm.
something has to be done,
Hmm.
and there is this gut feeling we have, and
Correct.
we do it, I always say that humans or surgeons or medical doctors, practitioners, they are the biggest AI. There's no doubt about it.
True.
And this new online AI is actually an assisting and augmenting their treatment.
Treatment.
So in the end, who is benefited? The patient is
Patient is
benefited.
benefiting. The doctor is also
Doctor is
getting
also benefited.
exactly because the doctor is feeling better that the patient doesn't come with such a negative thought process.
And God forbid, I'll give you another example. If some ABC doctor does a surgery and it doesn't work out, God forbid, and patient feels that he has done something wrong. So previously, he used to go for second opinion, third
Yeah, yeah,
opinion,
yeah.
saying that the doctor didn't do a good job.
Hmm.
Now with AI, he'll get an instant answer.
Hmm.
He types in, for example, and says, "This is what has happened to me. Did the doctor do it?" I will I would say maybe 99.99% of the time, unless and until the doctor was very negligent in one sense,
Correct.
99.99% of the time the AI is saying the doctor practiced within acceptable range of
Range of
treatment.
treatment. Wow.
After that thing comes, there is no way any patient can come and say, doctor, you didn't follow protocol.
Hmm.
There is no way a patient will feel upset or frustrated with the treatment that
The doctor has done.
because everything said and done, doctors are also humans.
Exactly.
So
there can be challenges.
there can be challenges, there can be mistakes, but unintentional, obviously. And extreme negligence, anybody can show the red flag. But with AI, a lot of confusion has actually got solved, because now the AI itself is saying this doctor has practiced correctly according to every guideline possible. It traces hundreds and thousands of articles, and these are the guidelines. And yes, the doctor has followed the guidelines.
Wow. So that actually helps. So AI is helping the doctor's
Definitely,
segment.
any doctor who does not include AI in his practice is going to be left behind. I'm very, very
Absolutely.
sure about this. You have to use AI not only.
So this is one question I want to ask, and I ask everybody whenever we have these conversations on a podcast. So do you think AI is going to take it over?
Very difficult question, ma'am, but to be very frank, not possible as of now, because I always say for AI taking over, this is like the doomsday conspiracy and all that.
Correct. Yeah.
So if you really see, there for AI to take over, there has to be a mother AI.
Correct.
A mother AI which is coordinating everything, and that is impossible because whatever AI is there are all individualistic. They're separate. For example, you take there are different AI apps.
Correct.
None of them are what shall I say, connected with each other.
Correct.
Unless and until a big mother AI comes, which is going to, like all that Terminator series and all that, I don't think anything like that is going to happen. As long as we keep on refining it, I only see that it is only going to maybe I'll go the extra step, maybe get cure for cancer.
Yes.
Or maybe help us become a spacefaring civilization.
Yeah.
So everything we are going to do for the next few centuries will be AI driven. There's no doubt about it.
Because I think AI can detect cancer much in advance, which people have, that is what
they do, but it can definitely be a more important sensitivity. It can detect in that sense. So unless and until it's going to be too much interdigitated, intertwined, and a super AI comes and all that, which is again
do you think AI can do operations?
We do surgeries with robots. I mean, I have done surgery with robots where I punch in the the cuts that I require, and the robot comes and cuts it. To be very frank, between in this podcast, I'd like to say nothing to beat a human experience, but always assuring to have a robot, because again a very small subset of patients can come with a little complicated surgeries,
and that's where the robots can help.
When you have the science, why don't you use it?
Absolutely correct.
Previously we didn't have the science. It's not like that science is important everywhere, every time.
True.
But when it is required, when you have the science, use it. Why do you want to take an experiment?
And as a patient, patients are okay with that. Then when they get to know there is a robot also along with the doctor.
To be very frank, we did a research scientific study which we have sent for publication, and we actually found that patients are more lenient. They're more leaning towards the doctor.
Of course.
That is, if you don't have a robot, it's not like the patient won't come.
Right.
They'll say, you're there, Dr. Mithin, we are coming. Or you're there, Dr. Evazi, we are coming.
Exactly.
It's not like, oh, this robot is there, we are going there. It's not like that. Still, patients do seek a good accomplished surgeon or a doctor for getting treated. Having a robot is an add-on.
True.
It's like a supplement. It's like an add-on.
Correct.
Because the science is there, it's nothing wrong. Patients might want it or might not want it. But still, as of today, patients prefer a well-experienced, good doctor.
Always. I think that's human touch. Is something
very, very
we
important.
all, as human beings, we
very
prefer
important.
a human touch.